I'm going to make a request that everyone switch off their cameras and switch off their mics unless I invite them to speak. I am your moderator for today, and I have finally found my voice. I am Dennis Ganendra, Council Member for REAAA and Chief Executive of Lincolnshire. I would like to welcome our President, Mr. Romeo Momo, who is an accomplished civil engineer and public servant with 43 years of devoted service to life, of his life to country and people, and is currently a congressman in the Philippines. President Momo, for your opening remarks, please.
Thank you, Dennis. Our distinguished speakers, ladies and gentlemen, a pleasant afternoon to you all. Let me start by wishing you and your families my personal best for your health and prosperity during these very trying times. We would also like to take this opportunity to express gratitude to our respective healthcare and other essential workers who selflessly continue in their duties and in support of us all. May they take comfort in knowing that their sacrifices will not be forgotten and that every fruit of their labor brings us all closer to a healthier future. 12 months ago, none of us could have imagined how our lives would be thrown into a turmoil by COVID-19 pandemic. Indeed, it has not only caused tragic loss in terms of life, but the measures needed and justifiably adapted to fight its spread have indubitably turned the world upside down. Unfortunately, the economic and social consequences of this pandemic are grimmer than expected. In 2020, to illustrate, the IMF expects global growth to fall to negative 3%, the worst economic downturn since the Great Depression. Further, as reported by the International Labour Organization, global income from work declined by more than 10% for much of 2020, with a figure as high as 15% in middle-income countries. In terms of human lives, on the other hand, as reported, 2 million people have already died because of the virus, with 96 million individuals more infected across the world. Worst, due to difficulties in accessing humanitarian seating, all this, as we know, may just be the baseline. With the discovery of new strain of COVID-19, we know that it could possibly be and could get much worse. We also know, however, that despite these insurmountable uncertainties, we can and must chart a path moving forward. Although universal vaccination remains to be the only permanent solution, there are 3 things that we must do in order to save lives. First, we must suppress transmission. This includes, first and foremost, the religious practice of social distancing, wearing face masks, hand hygiene, and reduce movement. Second, we must improve post-infection capabilities. This includes enhancing surveillance and contact tracing system and improving healthcare and quarantine facilities. Finally, as we transition to the new normal, we must build back better. In all these areas, truly, the road and transport service sectors portray an important role. However, as transport organizations shift from moving the general public to only ensuring the mobility of the key workers and freight of essential goods, there also come about sudden change in the sources of the revenues, with many experiencing income shortfalls. Under the circumstances, operators will need to plan ahead to ensure that transportation networks are equipped to return to normal operations once COVID-19 pandemic measures are lifted, and that they can continue to operate during and despite the effectivity of lockdowns, maintaining a balance between reduced operations and providing enough space for key workers and eventually the general public to be able to practice safety protocols. To this end, impacts must be assessed and long-term investment programs be replanned and reprioritized in light of the sector's reduced operability. On this note, it is my great pleasure to be joined today by our esteemed speakers to discuss the impact of the COVID-19 pandemic on the road and transport service sectors, the urgent need to buttress its adverse consequences, and the measures and initiatives pursued by relevant stakeholders to alleviate its effects in our economy and the lives of the people. With our collaborative effort and sharing of experience and ideas, I am confident that our endeavor today, webinar series number 2, spearheaded by the Road Engineering Association of Asia and Australasia, shall be a fruitful and memorable one. Thank you for joining us. Once again, a pleasant, healthy afternoon to you all. Thank you.
Thank you very much, President Momo. Now it brings me great pleasure to invite Mr. Claude Van Rooten to say some opening remarks. Claude has had an illustrious career in private sector research and is now leading the largest road association in the world as president of REAAA. Welcome, Claude.
Thank you very much, Mr. President, dear distinguished guests, dear coordinator, and allow me to say, dear friends of the Road Engineering Association of Asia and Australasia. It's always a pleasure to meet you. We met in Kuala Lumpur 2 years ago, last year in Abu Dhabi, and now, well, I'm at home in Belgium, 1 degree rain, but I will let you enjoy your heat there. We are facing a very difficult situation now, but I just want to remind you indeed what we are. Next slide, please.
Next slide, please.
Thank you. You probably all know what is PIAC. I will not go into details to let enough time to the real speakers I am just introducing, but we are indeed founded more than 110 years ago, and we want to organize exchange of knowledge on all matters related to road and road transport. We have more than 100 member governments, and we are very pleased that in your big region, because you are more than one continent in your organization, many members are present. Next slide, please. That's the point that I want to insist on today. We really value the cooperation with you associations, and that serve the following purposes. We amplify the outreach of PIAC in the region, adapting it to regional specificity, and we try also to reduce the language barrier, among other things. And I should mention also, we all in the world enjoy your experiences. I want to stretch the very good collaboration, and it has been concretized with 3 technical committees that you have set up: climate change resilience and emergency management, pavement technology, and road safety. And we are really eager for these 3 committees to exchange information with all world committees. And that's why we also look forward to your next event in March, and that you see on the screen. Next slide, please. This is an overview of all the technical committees and task force within PIAC worldwide. You are always invited to follow them and to participate. You have members in many of them, but really the interaction between all the experts of the world is my key message, my key obsession, I would say. Next slide, please. You could be surprised that I speak about a World Winter Service Congress. Well, it is important that you know that our next world meeting is with road resilience also. It's open to everybody, I would say, open to experts from all climate zones. I know that you have no snow, or mostly in some, well, in some of your countries, Japan, for example, but it's relevant here in this case to all countries. 3 languages, call for paper is already open, and I would say is almost closed. You can still send submissions or abstracts. And I would say, as today is a meeting of not so many people, however, it's good to know that there are meetings planned not only in the 4 years summer Congress, if I could say, but also in the Winter and Resilience Congress. So please feel welcome to join us also on that occasion. Next slide, please. This is again an overview of our congresses. I just introduced the first one, Calgary, but do not forget the next step for everybody will be in Prague in October 2023. All those information will of course stay in my presentation, which will probably be distributed or accessible for you all. I don't want to take much time of the experts who are now going to speak. I am also very glad, and thank you for that, that you also invited Patrick Malejak, our Secretary General, because I want to congratulate him here on the screen for all your countries, that he set up our working committee about pandemic. He will talk about that, and you will see what has been achieved in 1 short year. I think it's a nice example to see all the specialists of your association and then interaction with our Secretary General. And that's why I will take less than my 10 minutes to let you all, and him of course as last speaker, enough time to discuss the real stuff. I wish you a very pleasant meeting, and I stay of course present to follow it, but I switch off my microphone and my camera. Thank you very much.
Thank you very much, Claude, for that. And now I would like to start the seminar in earnest. Before I do that, just a few rules and information. Again, I request that non-speakers keep their mics muted, and only the speakers turn on their camera and their mics. There is a Q&A function that you can use to pose questions. There will be a question and answer session at the end of this presentations, and I will be taking the questions posed on the Q&A section and posing it to the moderator. It'd be good if when you pose the question to explain where you're coming from, and then if you're directing to a particular presenter, to tell us who you're presenting it to. Secondly, there will be a YouTube video of this webinar that we posted in a few days' time after it's over. So don't worry about scribbling down notes and taking photos and taking images of what's presented. It will all be uploaded for you to enjoy shortly. And with that, I would like to invite our first speaker of today, Dr. Richard Yeo. Richard has over 30 years of experience and management experience in the road sector. He was recently appointed the chair of the Australian chapter of REAAA, and he is currently the Chief Operating Officer of ARRB. Richard, thank you.
Thank you, Dennis. Thank you very much. Just wondering, can you see my slides there?
Yep, no worries.
Yep, we can see
Okay. So it's certainly my pleasure to present to this webinar today, and a very interesting topic. Speaking on behalf of what we're doing in Australia. Is that slide changing?
Yes.
Yes,
Great.
yes, see that.
Great. Okay, so the Australian Road Research Board, I'll refer to us as ARB. We've been obviously in operation for many decades, 60 years we celebrated last year. And this year we've just developed a new strategic plan. And our vision going forward for the next 4 years is an integrated mobility future, which is safe, sustainable, and a driver of economic well-being. So in this context, I thought it would be good to talk about integrated mobility and impacts of COVID-19. Of course, there's lots of impacts on our transport system, and our future transport landscape will probably look very different to what we know today. And these impacts are happening as we speak. New vehicle propulsion technologies, electric vehicles, fuel cell vehicles, drones, connected and automated vehicles, resilient and sustainable roads, using waste, solar roads, all those sort of things. And in this context, we're trying to develop an integrated mobility future. And as we say, it's time for an infrastructure reset and rethink how we might provide for this future. Items such as mobility as a service, shared spaces, innovative vehicles, last mile mobility, of course, road safety, and of course, this becomes a new economy. Under our new strategic plan, we've established 6 strategic work groups that we structure ARB's work into. And I'd like to talk about 5 of these in the context of COVID and the types of activities that ARB are doing to contribute in this space. I won't talk about ARB certification because that's a new area that we're just kicking off. So we haven't got much work happening in that space to talk about as yet. Start with future transport systems. And I think a lot of the presentations in this space talk about data. And this future transport systems is all about data fusion, integration of various data sets, and collection of data, and then turning that into knowledge. So overlaying and looking at some lessons that we can learn from data. One of the areas we looked at was congestion and perhaps people's journey times and their level of frustration on those journeys. So of course, congestion is a major issue for all of us in Australia. I think the annual cost of congestion is something in the order of $20 billion. And we identified the worst commutes, for example, from home to office in Melbourne. And we rated them on a whole range of parameters, not just the travel time, but the road width and the condition of the road, those sort of things. So we hit the papers with that one. Of course, we do other things to manage and avoid congestion. And I know there's lots of presentations around and technologies around motorway management. In Melbourne, we have a very, very good smart motorway system. And through implementation of these technologies, we've improved our traffic flow in the order of 10 to 20% using a smart managed motorway. Of course, COVID could be seen as another approach to deal with congestion. I don't think it's a good one, but it certainly had a huge impact. And our motorways traffic flow with our lockdowns in Australia were down 90% of travel. And but when you look at COVID, as the introduction stated, it's certainly not a good solution for congestion. In Australia, we have around 28,000 cases, 900 deaths, and of course, the hit to our budget or our economy is in the trillions. You know, it's certainly not something we would advocate. Of course, there's other logistics challenges as well with COVID in terms of getting commodities to market and levels of demand and spikes in demand. And in terms of our future transport system, as we said, we're into now second year. We just finished year 1 of COVID. We're rolling into second year, and we have challenges such as public transport's not what it used to be. How do we keep safe? Are we going to use our trains and trams and bus system? Or are we going to return to work in our private vehicles and cause more congestion? So rather than being a solution, causes more congestion. And these are some of the questions we're facing with as we come out of lockdown in Australia. I'll just move to the infrastructure now, and future transport infrastructure is a key area that ARB's always worked in. In this space, we look at, we have a very long, extensive road network across Australia. We want very cost-effective all-weather roads. We want improved durability, optimised resource use, and of course, we look at the life cycle costs. I always like to put a photo of the accelerated loading facility up. It's one of our tools to look at future transport infrastructure and pavement performance. What we have done in Australia is our strategy against COVID is towards elimination. So we've had lockdown, closure of borders, people are not able to travel. People not able to travel has impacts on our system. One of the measures could be the amount of petrol or fuel sold for passenger cars. And the estimates are that last year that was down about 21%. Aviation travel with the borders closed, domestic aviation down 64%, and our international borders, being an island, but definitely locked down. So international travel down 98%. Nobody is travelling inside or out of Australia. What does this mean? What are the implications for our transport infrastructure? Well, the headlines would say there's no one buying fuel, so our oil refineries are at risk. What does that mean? That means that bitumen supply in Australia is at risk. We've had fairly stable bitumen supply. Saudi Arabian crude refined locally. We have 4 refineries, or we had 4 refineries in Australia, and we know the properties of the bitumen that we use, and our specifications are tailored around this. Oops. So if we have one refinery in Perth already closing and question marks over the Melbourne refinery, we will have to import bitumen. And of course, the properties of bitumen are critical to our future transport infrastructure. We don't want our bitumen to age prematurely, to become brittle and hard and crack. And on the other side, we don't want it to be too soft. We have specific applications with our spray sealed surfacings, and we've seen lots of issues around bitumen quality. So it's a long-term issue for us if we have this step change. We don't refine locally, and so ARB's involved in looking at what specifications, what requirements should we have going forward on the basis that we'll be importing bitumens from different sources. I see some other presentations in this webinar around safety, so I'd like to move to safety and our strategic work group on safe roads and infrastructure. As I said, the travel is down, and usually when we have an economic downturn, we have an improvement in the road safety statistics, a reduction in deaths and serious injuries. As I said, we're down 20% on petrol sales, and looking at our vehicle loops and detectors through the SCATS traffic signal system, vehicle detections are down between around 30-35%, and surveys of travellers indicate travel is down up to 55%. So we should be seeing some significant improvements in road crash outcomes. So in this context, 30 to 50% reduction in travel, what are we seeing in our crash counts? So I'd like to introduce a new journal that we just published, a new ARB journal, the Journal of Integrated Mobility. And one of the papers in this journal, which you can find, I've got the link there, talks about the impacts of COVID on fatal crashes in Australia. Overall, crash rates have reduced by 10% nationally, but if it travels down 20 to 50%, the crashes should have reduced more than 10%. And then if you look at specific road user groups, drivers, they're only down 5% of crashes, and cyclists are actually up 29%. Now the numbers are small when you compare pre and post COVID, but it is a worrying sign. So COVID is not a solution for our transport safety problem. In fact, things are getting worse with COVID. I'll move to another strategic area, sustainability and resilience. So we talk a lot about this, and we break our strategic work group in this area into 3 key areas: smart cities and sustainable futures, life cycle analysis, and economic evaluation, and recycled and alternative materials. There's some words around what sorts of things we look at. And of course, with issues such as climate change, greater extreme weather events, and global pandemic, sustainability and resilience is a key part of ARB's future and where we can support the transport system. Some of the areas that we're working in here, as I said, economic assessment, pavement rehabilitation treatments, resilient pavements and surfacings, particularly in light of changes in bitumen supply, recycled and reclaimed materials. We want to reuse as much waste and have a circular economy. Vehicle emissions, electric vehicles, hydrogen fuel cell vehicles, how do they impact our transport system? And of course, you know, flooding, we've had already 2 or 3 cyclones, I think, this year. We've had bushfires already. So these are continuing challenges for the integrated mobility future. And finally, I'd like to discuss road asset performance. And I started by saying future transport systems all about data. So in this area, ARB collects road asset data, and we have some very sophisticated equipment to do this. In this case, it's a traffic speed deflectometer, but we've added a whole lot of other technologies to this, and we're surveying pretty much the state and national highway network around Australia and New Zealand with this iPave, Intelligent Pavement Assessment Vehicle. Of course, we have systems to collate that data and present it to the asset managers to enable them to make optimized decisions about managing the network going forward. We also have intelligent safety surface assessment vehicle, which is measuring surface friction, as well as a whole range of other parameters, all at the same time, all co-located. We bring all this knowledge that we have together and publish best practice guides to guide road agencies, local governments in how to manage and operate the network into this integrated mobility future. And we're adding to this series. Last year, we published 4 new parts and revised parts, and we'll add recycled materials and transport safety this year. So that's a bit of a snapshot of what we're doing at ARB and how COVID, some of those impacts of COVID are happening in Australia. Our situation in terms of the government is very focused on elimination and safety. So they're following the health advice and scientific advice. And as a transport system looking for integrated mobility, we're trying to respond to those things that are happening and look for that sustainable and resilient transport system going forward. I'd like to leave it there. Thank you very much.
Thank you very much, Richard. Next, I'd like to invite Dr. Marizwan to give his paper. Dr. Marizwan is one of the pioneers in the establishment of the MIROS administration and is currently the Director, Road Safety, Engineering and Environment Research Center at MIROS, the Malaysian Institute of Road Safety Research. Doctor, please take over.
Hello, everybody. Nice to see you all. Very good evening and also very good morning to those who are outside of Malaysia. It's a great honor to be here again. This is my 4th time presenting road safety related with COVID, and I've been updating the data information coming in recent months. So I hope to share some good information on our current research, and also I would like to share my thoughts on what's going on and what will happen in the next future. Everybody hear me? Is it okay?
Yep.
All right, thank you. So I will start. My content is pretty much simple. I will show you where we now, some current facts, and I will start briefly on the fundamental of road safety because it relates on the impact of COVID, you see. And then I will talk on the current data that we have, and then how does our mobility affects our mobility and affects the road safety in Malaysia right now. And then I wrap up with our current study on speed and volume in Malaysia right now, and I will give my thoughts at the end. So if you look at where we are now, I think Malaysia is far away off from the developed countries in terms of road safety. We are ranked in 126 among countries which has the highest death rate per 100,000 population. Something that we are not proud of. But if you look at the trends that we are looking at now, as you see graph here, we are looking progressively well. Ever since MyROS have been established in 2007, and with our working closely together with JKR and also our agencies in Malaysia, we managed to bring down considerably high number of fatalities. So without doing anything for what we forecast in 2020, if we do nothing, we get 10,716 deaths. But we are looking good. Our fatalities are going down with our interventions such as red light cameras, speed cameras, and also other interventions from our ministers. So everything is looking good so far. And if you look at the current facts right now, if you look at the road death in 2019, we clocked around 6,167 deaths. That is 2019. And per 100 population, we got 19. And if you look at the road traffic mortality rate, which is based on the active vehicle, this is a very approximation, it's around 0.3%, which is very low. Our traffic death per day is 17 per day, which is bad. And what if we compare to COVID, you see? Our recent death, yesterday, we clocked around 700 deaths from the COVID. And if you look at the mortality rate, it's 0.4, which is higher than road death, you see? That's why people are afraid, not knowing these facts, of course. But this is something that we can think about. Fundamental road safety, I just want to touch a bit on this aspect. So when we look at road safety, we are looking at three components, which is the exposure, the crash rate, and injury severity. So to reduce person killed or injured, we are looking at reducing exposure. We are looking at reducing the crash rate. We are looking at reducing the injury severity. And of course, lastly, we are looking at shifting travels to means of transport that would lower level of risk. So that's clear. Everybody road safety personnel who have delved into road safety knows about this. Now, looking at this and the current study that I've managed to gather, what people say now is like reduced traffic volumes due to lockdown lead to a slight increase for speeding by 6 to 11%, which is quite alarming. I think this confirms with other studies such as ARP just now. More harsh acceleration and harsh braking, around 12% increase. High increase of mobile usage also was detected in previous research in 2020. And the effect of economic downturn has led to increased stress, anxiety. People are stressed up, and there were studies shows that alcohol assumptions was high, and there were greater opportunity for speeding and stunt driving. And also effects of other mobility and services. When there's total lockdown, people avoid public transportation, and this is because of the close contact and the personal space.
I didn't catch that. Could you try?
And then there's increased use of bicycles, which also evidently happening in Malaysia. And also, what worries me is also the stretched emergency service, which could use to elevate the injury severity, but now more focused on the COVID patients. And also, we are looking at also stall road safety implementations of policy and enforcement. So that is what the current literature says. Okay. Now, this is the data that we gathered. Looking at the data that we gathered from Apple Maps data, mostly on Apple iPhone users, when we plot the movement or of the daily lives in Malaysia, and we plot the fatality data, when the government introduced the movement control order on the 18th March until 12th May, there was a huge drop of movement. Okay, 100% is the baseline of basically saying that we are not doing anything. We are not moving from our house. And then this movement has dropped, you see. People started not doing anything and staying in the house. And our fatalities dropped significantly. Until right at the May 12th, it has dropped to the lowest, around 167. But when the government decided to open Malaysia with the recovery movement control order starting from 1st June until 30th October, there were worrying signs of our increased fatalities. So after that, we didn't get any data. So I'm still waiting from the police data. So I'm expecting worse, I think. And if you look, and when we look further into the phases of this movement control order, during normal days, we clock around, before this movement control order, we have around 17 deaths per day. During that 16 period, during March until 17 March, there were around 1,100 crashes per day on average. But total was 17,000. When the movement control order was introduced, the total number of crashes dropped to 5,498. So does our fatality, right down to 58, which is around, the decrease was 365%. But when we open back, it increased 75%. Okay, this is expected. I think everybody knows about this. But what alarms me, also our organization, is that on normal, we have 60% of motorcycle fatalities. Okay, but when we open back, the rate fatalities for motorcycle increased to 70%, which is really, really bad on motorcyclists. And other evidence shows that during that time, only the movement control order, motorcycle fatalities increased to 73%, and mostly around our federal, state, and municipal roads, and also affects our highways and expressways. When we didn't get much data from the police, we looked to other means. We look at the media, because media has been actively reporting on this fatal cases. When we look, there's a slight drop here in March and April and May, which is the movement control order. But what I like to attract our attention is during that time, March, April, May, on our normal days, we have a lot of multi-vehicle crashes. And during that movement control order, the single vehicle crash increased, which is around April here. So, mean to say that there are a lot of fatal single vehicle crashes during movement control order. Seems that people are dying by themselves.
Medyo kumukonti-konti na yung mga COVID cases namin. Buti naman, Doc. Nakapahinga-hinga na tayo. Medyo maluwang ngayon.
If you're not speaking, can I ask you to mute? Thank you.
Okay, sorry about that. Okay. When we look at our, we did manage to have some online survey conducted in the 2nd of April to 14th of April. And what we found out that during that time, people usually travel around 34 kilometers on average. But during MCO, the travel distance dropped to 11.8 kilometers per day. So around 65% reduction on that time. So this is expected. Now to our latest study. We commenced this study during our latest MCO. Started around January, mid-January. This is to collect again what has happened before MCO and also during MCO. because government has recently announced again MCO because of due to our high number of cases. So we took this opportunity to collect our road safety data, because on the first MCO, we did not manage to collect anything because it was such a surprise. So, and during this time, we collect the volume and the red light running, and also we collect the speed data at selected highways. And for your information, during this time, we cannot move more than 10 kilometers. So we are restricted into our site verification and site selection. Just to show the situation now, looking at before MCO, the late right running are mostly done by motorcyclists. But during MCO, the cars has joined the party. they've also run the red lights. And if you look at the peak hour, it seems that during off-peak hour, there are more cars detected during off-peak hour. I think people choose to be more on the road during off-peak hour. And we can see there's a slight increase of motorcycle usage during that time of the off-peak hours. I think mostly maybe due to food deliveries and other goods deliveries. And what worries us is that motorcycles still run the red light. And there is an undeniable fact that there are high occurrence of red light running during the MCO period or lockdown than the normal period. And if you look at the speeding, everything goes up. The mean speed during the MCO has increased. Our 85 percentile has increased from 92 or 90 km per hour to 100. And we're looking at our increase in our 85 percentiles from 54 to 65. So this is quite a worrying situation in terms of speeding during the movement control order. This is another issue. Yes, there were high increase of usage of bicycle. I think this study also concurs with AARRB, and the police says there was a lot of there were 201 crashes involving bicyclists in 2018. And if you're looking at the current data that we collected from the police, January to October, there were around 137. We expect that there should not be any bicycle crashes, you see, during the lockdown. But unfortunately, there is some, and there's almost the same amount of bicycle crashes compared to 2019. So this shows that people want to move, want to go out, and they are willing to change their mode. During before COVID, people like to run, you see, but now people due to social distance, people choose bicycles. So
2 minutes, Doc.
Okay, I'm almost done. And potholes. I'm trying to relate this to COVID, but somehow we are not getting much data on the number of potholes. But according to the Public Works Department and DBKL or City Council, I agree that there are problems with potholes due to the fact of third-party contractors resurfacing subpar remedial works done by the contractors. But based on our theory, there is something got to do with total lockdown. I think when we lock down our country, somehow it prohibits the construction and roads maintenance. So it disrupts the scheduled maintenance. And then again, when we open back our road and people started to moving, road users are less aware. When they start to speed and they're less aware of the road hazards such as potholes. So this is something that we need to look into in the long run. When we open back our roads, those roads are left being unmaintained and so on. So to summarize, I'd like to attract everybody's attention to this simple metrics based on our road safety factors, exposure, crash rate, and injury severity, and looking at road user behavior, road infrastructure, and vehicles. Okay, now we know that exposure travel has reduced, but our speeding increased, red light running increased, stress among our riders are increased, traffic law compliance decreased, which is bad. I predict that road maintenance, scheduled road maintenance also decrease, landscape maintenance also decrease. Despite the welcoming usage of bicycles, which goes up, I think, which is positive, motorcycle usage also increase. Delivery service increase, public transport decrease, and also our vehicle maintenance decrease because we don't go anywhere. Okay. Crash rate decrease, pedestrian crash decrease, school children decrease, but single crash increase. Crash and construction decrease, running our carriageway increase, bicycle lane scarce. I mean, we need bicycle lane. Bicycle lane increase of this vehicle, delivery service crash increase, and also motorcycle crashes increase. Lastly, injury severity increase because of speeding, red light running, and also distraction. Injury severity also increased due to road maintenance, poor road maintenance, also poor sight distance due to large landscapes unmaintained. And lastly, injury severity also increased because of mode of shift has moved from motorcycles to bicycles, for example, cars to bicycles, and also strain to our emergency response services due to the COVID patient cases. What can we learn lastly? I think the figures is temporary. I think crash increase will be over time. New norms, people are shying away from public transportation, and I think we should look into bicycle usage in Asia country. Child exposure remain also at least if they're open. And lastly, I think MSU is just a pause. The play button I just pressed, and we need to know when to press stop. So I think new implementation road safety measures needs to be introduced after we open, or maybe we need to prepare for the unknown. Thank you very much.
Thank you very much, Dr. Marizwan. Now I'd like to introduce our next speaker, Dr. Florencio Pademal. Dr. Pademal is the chairman and CEO of Pademal Construction. He's also the chairman of the Project and Construction Management Specialty Division of the Philippine Institution of Civil Engineers. Dr. Pademal, thank you. We can't hear you, Dr. Pademal. We can see the slides, we can't hear you.
Yeah, okay. Okay, let me start. My topic is coping up with the COVID-19 pandemic health protocol in the construction. You know, the COVID-19 pandemic is really a big challenge in construction. But we have to cope up. Construction goes on, life goes on. So we have to move faster. Now, this is my presentation outline. I tried to study three big construction companies in the Philippines, how the health protocols are being applied. You know, pandemic, how do you acquire the virus? Person-to-person contamination, like face-to-face talking, or if your workers from bunkhouse to job site, you transport them. So there's a service vehicle. If you are not very careful about the health protocols, chances are there will be a problem. Also while you are eating, during break time, lunch time, and dinner time for those who are rendering overtime services. And then during meetings in conference rooms, and some religious activities. Now, also, by touching items with virus, particularly the heavy equipment and the use of tolls and vehicles in construction. Let me just walk through very quickly construction management. We catch virus if we undertake, we direct, we supervise projects, or we do procurement activities because there are so many vendors delivering construction materials. Also, the project safety, because you have to implement the project safety program, and during monitoring and reporting. Now, in the Philippines, the most basic, we have the occupational safety and health in construction. This one is even without the COVID-19 pandemic, this is being implemented. This is just a matter of designating safety officers and then developing and implementing construction safety health programs, and the details are shown in the slides. Now, during the pandemic, the Department of Public Works and Highways was very quick to come out with Department Order 35. This one pertains to the construction safety guidelines for the implementation of all DPWH infrastructure projects during the COVID-19 public safety. What does it mean? Prior to deployment of people, workers, and also during deployment. Okay, let's start. Prior to deployment, the construction workers are just allowed 21 to 59 years old, and then there should be a periodic COVID test. You're also required to come out with a construction quarantine pass. Welfare facilities and amenities should be provided, like quarters, lodging area, with adequate safety protocols, including disinfection. And then compliant to what I mentioned earlier, the Department of Labor and Employment Department Order number 13. And then supply of vitamin C as well. Disinfection of facilities, as I mentioned, like beds, the vehicles, the heavy equipment, and other things. And there is information dissemination and personal record for purposes of contact tracing. Now, during deployment, physical distancing is totally implemented. And then staggered break time, mainly because there will be people, the workers will not be in the canteen or in the mess hall simultaneously. So it's really staggered. Then the quarters housing, because there are many or almost all big projects now, the workers just stay in their quarters, and there are designated time for minimum errands only. Disinfection of facilities is normal, etc. Then came the joint memorandum circular, supplemental guidelines on workplace prevention and control of COVID-19. The main feature is that increased physical and mental resilience, because of this condition, it is essential that you are physically and mentally alert at all times. Then reducing the transmission of COVID-19, and then minimum contact rate as much as possible, like flexible time or the staggered schedule of work. And then as much as possible, face-to-face interaction is discouraged. And then the reducing the risk of infection from COVID-19, testing as well. Let me just walk you through to several actual things that are happening. Let's see how these government regulations are applied. This one, as you enter the workplace, there is a thermal scanner. If you entered, you have to do hand washing. So there are stations, and there is this 1 meter distance interval. And then while eating, physical distance is observed. The same holds true when you're queuing before eating, and you have to use your face mask as well as the face shield. Then disinfection of workers' quarters. This one is done periodically. Disinfection of incoming vehicles. If you notice, you can see from the picture, it speaks more than words. This one is hand punch operation. Then the foot bath. This one is disinfection for the shoes, the footwear that you do. It's very strict. No face mask, no entry. This is a case of excavation work for drainage system of a rail project. You can see the distances, the physical distance. This one is survey work. Usually, like the three workers, they converge together, but they maintain certain distance. Now, here, this is a skyway project. You can see the bigger picture, they maintain the distancing and they wear face masks. But the inset, apparently, they're not observing it properly. Now, this is another case. And for new employees, they undergo certain requirements like certification of by a licensed physician that the said staff did not manifest any COVID-19 symptoms. Then here, there is the primary screening protocol being done. Then next is all frontliners must wear PPEs. This is basic for occupational safety and health, but it was enhanced by using the face mask and other health protocols. This case is also the foot bath being used, as well as washing hands. This is another case. It's another company. So in short, they really apply the requirements of government, particularly the 1 meter distances. And then what's this? The use of face mask is really mandatory, and there are different billboards that they place around the project site. This one is the hand washing, the disinfection of drinking areas. For this case, even the computer inside the office of inside the job site is being disinfected. Even motorcycles used by construction workers are disinfected. Then here, for this case, this is where they eat or sometimes have meetings, but you can see the distances around it. And there are a lot of containerized van housing, and they use a double decker. So at least they're not too close to each other. I mean, the construction workers are not too close to each other. This is a typical road construction. I just would like to highlight that if there is a change in operator, there's a disinfection being done around the equipment or the heavy equipment. And then this is another company. That's how indigenous they do for alcohol dispenser. This is the bulletin board stating certain health requirements and the health protocols. This is again disinfection from another company, the thermal scanning and disinfection along the way around the job site. There are cases where the construction company they allow that their workers to go to churches but observe social distancing in attending church services. This is a typical improvised health screening area. the conclusion is that I just want to conclude that I prepared a matrix, and this is my last slide. The first one above is the occupational safety and health construction. The one below are the health protocols. Whether you like it or not, you have to observe the occupational safety and health in construction. That's very basic. Using the PPE, the signages, and other things. No? The health and safety program. But in health protocol, for every stage, for example, in the quarters, you should have face masks. But the moment you stand up, you wear your face shield. Also, you maintain physical distancing, and then there is a person assigned for periodic disinfection of the beds and the cabinets within the container van housing. And then there is limited errand for food and necessities while you are inside the quarters. And then if you move, going towards the project site, there is a service vehicle. But inside the service vehicle, there is physical distancing. And then the periodic disinfection. This is usually done by the driver of the vehicle. And then inside the project site, there is disinfection, including the foot bath. Then the temperature scanning, then the health screening, and maintaining record of all of these things per construction worker. Then there is this daily health symptom questionnaire that you accomplish, but and validated by the safety officer. Alcohol dispensing, hand washing are made available in designated stations. Then physical distancing is inside the project site is observed while you do Bundy clock punch for buildings, construction elevator, queuing for food, attending religious activities, and going to the toilet, especially going to the toilets. Then there is a recording mechanism and to monitor whatever health issues there are, so that people, the other construction workers, will not be contaminated. I made it very brief. Thank you very much, colleagues.
Thank you very much, Dr. Padana. Now I'd like to invite Ms. Wen Yu Liu, the Deputy Chief Engineer, Freeway Bureau, Ministry of Transport and Communications, Taiwan. Ms. Wen. We can't hear you, Ms. Wen. Ms. Wen, I think you're still muted. Ms. Wen, can you, we can't hear you. Ms. Wen?
Ayaw nga.
We can't hear you, Ms. Wen. Ms. Wen, can you sort your problem out?
Datuk, your microphone is muted, Datuk.
Can you hear me? I have two. I'm going here by second mic. Can you hear me?
I can hear you, Dato'. I think we can hear you.
Yeah, okay. So, Miss Wen, we can't seem to hear you. If you don't mind, Miss Wen, we'll give you 1 more minute, and then we might jump to the next speaker, then come back to you when you sort your problem out. Miss Wen, can you try again? I had a similar problem, so I think we have to be a bit patient. We give her maybe 10 more seconds. Miss Wen, can you solve your problem? What I'm going to do, Miss Wen, we'll come back to you. I will jump to the next speaker, Dr. Surowit Naruputi. So Dr. Surowit is the Associate Professor, Head of Transport Engineering, Division, Department of Civil Engineering, Faculty of Engineering, Chulalongkorn University. Ms. Wen, we'll come back to you. Maybe we give you a few minutes to sort out yourself, 15 minutes to sort yourself out, and we'll come back to you. So Dr. Surowit, may I ask you to go first?
Yeah, all right. Thank you very much. And ladies and gentlemen, first of all, I'd like to say it's my privilege to speak in this webinar. I'm from academic, so I monitor the progress of transport in Thailand. Today, I will give some description of impact of COVID-19 in Thailand and the measures that we have adopted since early last year. Okay, I'd like to show you statistics of COVID cases in Thailand. I gathered it on July 18, about a week ago. Compared with other countries, Thailand is ranked 128 in the world. We are lucky that we have far fewer cases than most of the countries in the world. We have to give credits to hardworking of healthcare personnel and cooperation of Thai citizens. Up to January 18th, when I collected these statistics, the number of cases in Thailand is around 12,000 cases. Around 3,000 are in hospitals and 70 people died. Well, we look back last year, Thailand spotted the first case quite early, a few days after the announcement of COVID discovery in Wuhan, China. In late January, Thailand was the early country that announced the virus outside China. In Thailand, we announced the warning and measures very early in February when we found just a few cases. From the picture you see on the slide, you can see clearly that Thailand has 2 waves. The first wave was around March, and the second wave is ongoing now, starting in mid-December. The pandemic in the first wave was spread by people who travel back from other countries, mainly tourists and Thai people who travel abroad. The pandemic in the second wave, which is more serious than the first wave, comes from mainly immigrant workers who illegally enter Thailand and concentrations at some locations like nightclub or illegal casinos. By far, we have learned a lot from the first wave of pandemic. The report shows that 4 economy sectors have been hard hit by the incident. Economy sector, mainly tourism and air travel. Labor sector, workforces. So we changed from work in the office to work from home. The third sector is export, including logistics and transport. And the last sector is education, where teachers and students have to teach and study online. Well, we adopted measures depending on the seriousness of the situation. ranging from social distancing, travel advisory, checkpoint, up to business close down and curfew. Now, let me show you the impact of COVID-19 on travel. We use statistics from Apple company about the amount of travel each day derived from smartphone sources. From the picture, the amount of travel was reduced significantly during the early wave, the first wave. Also, you see this reduction in travel depends on the measures that we adopt, and also the changing of lifestyles and how people travel. The amount of travel by car driving for the entire country went down almost 60% in mid-January, from the base in mid-January. But the amount of walking even lowered by 80%. Nonetheless, the data from smartphone you see here is quite difficult to classify the activities. Walking can be also the activity of the people who ride on public transport. So we see later from other statistics to spot the amount of demand for public transport. Now, I'd like to show you the impact of the measures adopted and mobility trend. As mentioned earlier, we tried to learn a lot from the first wave of the pandemic around February to August. We used data from January to May and observed the amount of travel and lockdown measures. You see from the picture that the amount of travel during January and February begins to drop. But the major drop comes from the declaration of government measures in March. The strict measures such as close down, lockdown, curfew start in March and April. At the end of April, the number of new cases dropped to almost zero, no cases in a day. So we started to relieve the lockdown by several phases. The lists were also imposed, slowly imposed until June. In late May, when this graph was produced, we were also curious on how it was going on after May. The trend after lockdown relieved shows that the amount of travel backs up to a considerable amount. And at that time, we forecast that the travel might go back to normal in around July for driving. This picture shows a different source of data and maybe better to explain the amount of travel and COVID measures. The data came from government sources and we collected and analyzed by Ministry of Higher Education, Science, Research and Innovation, or MHESI. We analyzed data from January to early August, and we looked at different modes of travel. From the picture, you see clearly that the hardest hit of the COVID is on air transport. After the state of emergency decree, air travel was very limited, almost no passenger on commercial flights. Even the air freight transport was also decreased and delayed. The data also show that during April, when lockdown was very strict, the private car movement dropped around 50% from the normal amount. During strict lockdown, people restrained their travel, even to go out for shopping. Most of workers work from home. When the lockdown was relieved, the amount of travel increased, for sure, depending on types of relief the government imposed. It's interesting also to see the decrease in travel by other modes. Public transport, both buses and rail, experienced a drop by almost 80%. This clearly shows that people avoid travel on public transport during pandemic. People are even afraid of riding taxis. Next, I show you the amount of travel after the lockdown is relieved. This is for the first wave. The lift of lockdown created more activities, and hence people travel more. By early August, the travel by private vehicle gets up to almost normal travel, around 95% of normal travel. Air transport, which was used to get the hardest hit, increased up to 55%. Note that domestic flights resumed their operations, but the amount of international flights were still limited. I need to mention also that even though people resume their travel activities, the practices of new normal in travel apply to all people. People have been quite cooperative. Next, I'd like to show you and give you an idea on how we travel during COVID. Travelers have to aware themselves using masks, alcohol, and practice social distancing. We encourage public transport users to use contactless payment. We use apps to check in and monitor the movement. We have special treatment in the international border and even checkpoint on major roads. You may wonder the impact of COVID pandemic to road construction. Of course, it has some impacts. Contractors experience delay due to lack of immigrant workers and experts who come from abroad. The purchase of parts and equipment from other countries are delayed. Many projects negotiate with the owners to extend the project periods. From the government side, the government gives special arrangement to keep construction going. For example, allowing trucks to come into the city during the day, which was banned before, to continue the construction activities. Well, from the government side, 2020 is the year that we have a lot of activities in Ministry of Transport. The ministry has promoted and accelerates many new projects. Just for your information, the Ministry of Transport still proposes a big budget on many infrastructure projects. On January the 4th, a few weeks back, Minister of Transport announced many key projects from ministry, including big infrastructures like motorway, railway, and many other projects for transportation matters. Now, I'd like to give just one case of COVID-19 impact. I will focus on expressway. During the first wave of pandemic, March to May, we can see from the picture that the drop in traffic on expressway in Bangkok, the drop is around 34% compared with the same period of last year. Okay, I am lucky that I got another data from the second wave as well, up to mid-January. So on the second wave, the traffic also drops around 34% in the month of January compared with the same month in last year. Before COVID-19, many staffs and operators work in person and work physically close to each other. More than half of motorists pay toll by cash or manually. During COVID-19, it is important to reduce the close contact. Many measures are implemented actually. For example, at the cashier and people who work with people, they have to practice the highest hygienic measures such as gloves, alcohol, masks. Authority also encourages people to use EasyPass or electronic payment.
1 minute, please.
Yeah, that's all for me.
Oh,
actually,
perfect.
thank you very much for your
Thank you
attention. Yeah.
Thank you very much. Now, Ms. Wen, I'd like to come back to you. Can we try you again and see whether we got your voice now?
Hello.
Well, do you hear me?
Yes, we can hear you. Very happy to hear you.
Okay. Fortunately. Okay. Yeah, may I start?
Please start. Please start.
Okay. Ladies and gentlemen, good morning and good evening. It's my pleasure to present here. The topic I'm going to present is effect of 2020 COVID-19 on freeway traffic volume in Taiwan. This is the outline of my presentation, including 5 parts: introduction, analysis of traffic volume on weekday, weekend, and long holidays, and analysis of freeway service area, and the brief conclusion. This is the curve of the cases of COVID-19 in Taiwan. In the beginning of 2020, COVID-19 became a global outbreak all over the world. In Taiwan, the first case of COVID-19 was found on January 21st. COVID-19 outbreak had caused significant impact on life, and transportation is an induced demand depending on economic activities. We try to analyze the effect of 2020 COVID-19 on freeway traffic volume in Taiwan. This figure is a percentage change of toll fee per month. Compared with 2019, toll fee gradually decreased by 2 to 6% from January to April, and started to increase in May in 2020. In summer vacation, toll fee rise to 9.5% in August. The fluctuation is related to the confirmed cases of the epidemic shown in previous slides. First part, the analysis of traffic volume, comparison of all types of vehicle types. All the year round, the difference of the total freeway traffic volume of all types of vehicle types between 2019 and 2020 is within 1%. So the impact is slight. We go to the detailed analysis by month. Freeway traffic volume of all kinds of vehicle types gradually decreased to 11% in April, and weekend decreased more than weekdays. We have long holidays in October, so the freeway traffic volume hit the highest peak in that month. Then we analyze the changes in freeway traffic volume of different vehicle types. We found traffic volume of bus declined more serious than other kinds of vehicles. It decreased by 47% in April on weekday, and decreased by 69% also in April on weekends. This figure is a comparison of different bus types. We found that the freeway traffic volume of a tour bus declined more serious than scheduled bus. This is the shape of Taiwan divided into northern region, central region, and southern region of the west coast of Taiwan. According to the data of different areas, freeway traffic volume in northern region declined the most, shown in the blue line of the figure, both on weekdays and weekends. Furthermore, the comparison of different cities in freeway number 1 had the similar trend. But freeway number 3 had different result. Because freeway number 3 is near scenic attraction and the tourist hotspot, especially in southern region of freeway number 3. The freeway traffic volume surged from August to December. In addition, this is a figure of comparison of different freeways from number 1 to number 5. You can see the purple line of the figure. Freeway number 3 on weekends. On the right side of the slide, the freeway traffic volume surged from August to December. It's the same as the previous slides. This is analysis of the tree length per month. We define if the tree length is less than 20 kilometers, it's a commuter trip. For the whole year of 2020, the percentage change of commuter trips is insignificant. This is a figure of speed of time space diagram in different months, freeway number 1 southbound. It shows the speed change is relative to the impact of 2020 COVID-19. After the epidemic slowed down, traffic congestion occurred in more freeway sections. This is another figure of the speed of time-space diagram of freeway number 3 southbound in different months. We got the similar result. This is the freeway number 5. Traffic is very heavy during the rush hours in the recurrent congestion section, and especially happened around the summer vacation. This figure is a comparison of different weeks in the summer vacation. The freeway traffic volume increased the most by 12 to 20% from Tuesday to Thursday on weekdays in August. We use the ANOVA method to do the statistical test of the COVID-19 confirmed cases and the changes of freeway traffic volume to check the effect of COVID-19 on freeway traffic volume. According to the p-value, it showed a statistically significant difference. In Taiwan, we have several long holidays. Lunar New Year Festival, Peace Memorial Day, and the Tomb Sweeping Festival were all obviously affected by the epidemic. The traffic volume on those national holidays is decreased by 2 to 12%. After domestic epidemic started to gradually abate, it increased by 8% on Dragon Boat Festival, shown in the yellow color. This is a change of the freeway traffic volume of a long day holidays in freeway number 5, just for your reference. And the second part is analysis of freeway service area. The total revenue compared with 2019 reduced by about 4%, and the total customer reduced by 8.77%. You can see from the 4 figures, the revenue and customer on weekends of the right side of the slide decrease more than weekdays. This figure is comparison of the revenue and the customer in different months. Both revenue and the customer decreased the most in April. This is the date of the lowest point of the revenue in April, and the lowest point of the customer in the same day. About the long holidays, the revenue rate of the Tomb Sweeping Festival declined the most. Also, the customer rate. Finally, the brief conclusion. Freeway traffic volume on weekend decreased more than weekdays. The decline in the traffic volume of buses was more serious than other kinds of vehicles. Compared to different areas, freeway travel volume in northern region decreased the most. The epidemic obviously affected the travel volume on Lunar New Year Festival, Peace Memorial Day, and the Tune Sweeping Festival. After the domestic epidemic started to abate gradually, freeway travel volume increased by 8% at the Dragon Boat Festival. The total revenue of the freeway service area from January to October reduced by about 4%, and the customer reduced by 8.77%. The decrease of a customer is more than revenue. It shows the more people didn't enter the store. To be short, we found COVID-19 has a stronger connection with the trade of a freeway travel volume. We will keep track of this case until the epidemic is over. Thank you for your attention.
Thank you very much, Ms. Wen. I'm very glad we managed to get you back online to your very good presentation. Our last speaker for the day is Patrick Malajat. He's the Secretary General of PIAC, and his mission is to provide support to road administrations and professionals across the globe. Patrick, over to you. Thank you.
Thank you very much, Dennis. Can you hear me?
Very well, thank you.
Perfect, thank you very much. I'm really glad to be here with you all. There's a great audience, it seems, and excellent panelists, and I'm very thankful to our colleagues in Asia for organizing this webinar and for inviting our president, Claude Van Roten, and myself. What I will present is the work that's been conducted at PIAC for about a year now. So when the COVID crisis appeared on the international scene about a year ago now, we realized once again, you would say, that road transport is an essential service. People say that accessing food is an essential service, that hospitals are essential services. Obviously, that's correct. But if you think at what wouldn't work if road transport didn't work, we would be in a very difficult situation. So we realized that, once again, that roads have to remain operational. And that COVID-19, the pandemic, may disrupt road operations. So we have to anticipate the impacts of the crisis on road operations. And that's why we decided, together with our president, to establish a formal PIAC COVID-19 response team. So what we've done is to focus on the short term. It's a crisis, every day counts. A good idea at some point could save lives, really, and improve business resilience across the globe. It was urgent to share knowledge and practice among PIAC member countries, and also to provide support in near real time. Someone has a problem somewhere, maybe someone else at the other side of the world, in another country, have faced it already and could share how he or she has handled it. What we pointed out is that what works in one country may not work in another, and that what we were sharing is knowledge and practice that were not yet confirmed as valid or effective. So in other words, it's used at your own risk. The response team is here on that slide. I'm not going to go through all these names. I just want to highlight that I'm very thankful to be part of that team and to be co-leading it with Christos Christofrontos from the USA. And we have a couple of colleagues from the region, including, I guess many of you know her, Caroline Evans from National Transport Commission in Australia. So thank you very much to Caroline and from the support she received. We've organized more than 20 webinars, just like the one that REAAA is organizing today. Since we have 3 working languages in PIAC, we have organized webinars in English, mostly, as well as French and Spanish language. You have here a copy of some slides. We've addressed all sorts of possible topics, and we have invited our member countries and member experts to really take part and to come to the stage and present what they had to share with the international road community. And speaking of that, Dennis, thank you very much for having agreed some months ago now to speak in one of our webinars. And I would like to open the invitation to all our colleagues in Asia, Southeast Asia, us to, well, volunteer and speak and share the knowledge, maybe join PR committees as well, and to speak in one of our future webinars. We've also invited lots of our international partner organizations to join as panelists, because they were also, and they still are actually, covering topics that are related to road transport. We didn't want to cover their topics because they are the experts on fuel, civil engineering and transport research, police, urban transport issues. The World Bank, of course, doesn't need any presentation. The International Transport Forum takes a higher level, I would say, political view of transport issues. So they all agreed at some point to join our webinars, to share with us and the road community what they were doing, so that we wouldn't duplicate, we would learn from them, and also that they would understand that roads do matter. And of course, many panelists originated from the network of PR members. We've set up a website that's not unusual, you would say. On that website, you will find all the video recordings of those webinars that we organized on COVID-19 and roads, including the Q&A. The Q&A bit was really lively, as well as the presentations that were used. And I see in the chat that that's a question that is asked as a PDF file, of course. And those presentations were always translated and are available in English, French, and Spanish, as well as a number of PR reports that were already available and related to pandemic management. As you see here on the screen, you have disaster information management for road administrators, or security of road infrastructure, and a number of notes. Now, what we've done is encapsulate all that we found through these webinars in a detailed technical report. That report is available from our website. You have here in red at the bottom of the slide the link. I will share it in the chat later on. It presents the initial impacts and responses to the pandemic from road and transport agencies across the globe. It's available in English and Spanish, and the French translation should be ready in a couple of weeks. So what we have in there is a number of recommendations for road operators and transport administrations, as well as implementation recommendations. So I will not get into the detail of all of those, but I will present them roughly, and I invite you to check the report. It's available for free anyway. The first recommendation is to prepare the declaration of emergency. Well, a disaster like COVID strikes, what do? You have to mandate authorities with emergency powers, and you have to be ready. When I say you, it's road operators and all your network of authorities, administrations, including the police, for example, and border control, to issue orders and instructions to ensure that essential services will be delivered for the protection of people, property, and places, and to maintain activity in key essential economic sectors. That happened rather well across the world, I would say, but it needs to be really carefully prepared. You need to, that's recommendation number 2, to prepare economic measures to support businesses. This is where we've seen that approaches across the globe have varied a lot. In the road sector, I would like to highlight a couple that this is really important. You want to prepare recommendations for contracts, especially for public-private partnership contracts. Is the COVID crisis a case of force majeure, or is it not? Every contract is not written the same way. Local, national legal recommendations or legal frameworks can be very different. It's very important to give clarity on this, and this is something we are now working on. You need to plan to maintain road-related activity and business continuity. You need to help companies keep working together, even though their contracts may not have been prepared for such a crisis. And in some cases, you want to mitigate the economic and financial consequences of reduction in traffic. We've seen in many cases, like Taiwan just recently, that traffic has gone down. Okay, great. This means that toll operators get less revenues. Okay, how do they handle that? Do they need help? That's a key question. Roadworks, that was presented as well, but in 2 words, be alert and agile. In certain cases, you can accelerate works. You need to secure access to resources to ensure that work can continue. And maybe you want to start stockpiling strategic material. Recommendation number 4 is about data. And we've seen that data is really strategic for all organizations, including transport organizations, recognize that real-time information is needed. In some cases, in most cases, we know it, but it might be difficult to deliver it. For example, in France and many countries, it was difficult initially to get access to information for freight operators and truck drivers about showers. It seems very simple, but it's very important. Security. Many of us are aware working from home, including road operators, staff. That's not what they usually do. Their computers at home may not be secure. Please think about that. And some terrorists may use that to disrupt service. This links us to disaster management and resilience. What we're facing here fits really well in the concept of resilience of roads, of transport and road-related function. There are frameworks that can be used for this, such as the preparedness, response, recovery and prevention model, and you need to be prepared to face additional disasters while facing a pandemic. Think about Florida, for example, or earthquakes-prone areas. Passenger public transport, we've seen that in some cases, citizens were unsure that it was safe to use public transport because of health-related issues between passengers. The urban landscape in many countries and cities has shifted dramatically. More lanes for cycling, for example, are those meant to last? ITS can help. Freight and logistics need to stay open. Law and regulations need to be amended in some cases to make exemptions during pandemics. That's happened all over the world. ITS solutions and digital transition can support, clearly. And in the future, it's recommended to prioritize investments for key freight corridors. ITS, well, that's always very useful. There are some great low-cost operations and solutions that might be great ideas. I remember a case where a network operator used virtual reality so that experts would not need to go on site. And experts were actually in a different country and they were guiding local operators. And they did not need to travel, they did not need to meet, it was safer. Road safety, we've seen the impact, and winter service in some countries, that's really important. And how do you maintain winter service while your staff is experiencing COVID? Workforce, we need to celebrate road workers. I think let's be happy and celebrate them. They did a great job. You need to apply health and safety protocols like everyone else, and recommendations such as enabling women to continue to thrive at work are key. Design efficient processes for work from home. How do you implement that? Monitor the new transport normal. There are new priorities emerging. Okay, what are those? Are they meant to last? How can roads contribute to economic recovery? How do you evaluate all those measures that were implemented in a hurry? Are they all of them relevant? In which circumstances are these relevant? Do they apply to your country, to my country? And continue sharing knowledge. We do that at PIARC. It's proved essential, especially to engage with, well, I would say low middle income countries. We should not forget about them. Africa has been quite involved in our webinars, for example. So focus. There are pressing issues. We should not forget about them, such as adjusting to climate change priorities. Let's not forget about that. Focus on new strategic issues that are emerging, health, new normal, what is that going to be? And then focus on investments on roads that can contribute to economic recovery. In Senegal, they have a full an economic recovery plan. 15% of the budget is allocated to road investment and others. And roads are essential for innovative transportation services. And roads are also essential for public transport. Let's not forget about that. Roads do matter, and we have an excellent PIARC report about that. So next steps for PIARC, we are planning future webinars. The next one will take place in English next month. We organized a survey. We are digging into it to analyze that. We are evaluating the measures that have been implemented in a hurry, and we are looking with our microscope into the new normal. Is this really real? What are the new user needs? What is going to be the demand for transportation services in the future? If people work from home, maybe we need fewer cars and maybe even fewer roads, who knows? And all our technical committees are mobilized, of course. And I really invite everyone in the webinar today, if you want to know more about PIARC, about what our committees are doing, just contact me. I will be happy to assist you. Claude van Roeten, our president, mentioned our congresses. I don't need to go into that again. And I think this is it. Thanks. Thank you, everyone. Thank you to REAAA for the invitation, and I will be happy to answer questions if there are any. Thank you.
Thank you very much for that, Patrick. And it's interesting to see that a lot of the topics that you covered were covered in our first and second REAAA webinar. So what's happening in REAAA is very much reflected what's happening in the World Organization as well. Ladies and gentlemen, I think now we come to what I believe is the most interesting part of the webinar, which is the question and answers. You've got very knowledgeable people here, very smart people here, and this is your opportunity to pick their brains. As I mentioned earlier, there is a question and answer feature. So if you have any questions you'd like to pose to them, please type it in there. I would like to kick off the questions, and I'm going to pose it to all the panelists. Knowing what you know now, what would you or your organization would have done earlier last year, at the beginning of last year? With all the knowledge that you know now, what would you have done differently at the beginning of last year? And I'd like to go in order of how you spoke. So maybe Dr. Marizwan, would you like to kick that question off?
Wow, thank you, Dato'. Okay, what we know now, what could have we have done? I think we could have prompted our quick data collection on the current trends, because we did not predict the usage of bicycles increase tremendously, and also the shift from private transportation to private. So we did not expect that so much. We thought it was a total lockdown and people will start to seclude in their houses. But it was the other way around, because of we are worrying about the motorcycle trends and also bicycle trends. But other than that, I'm just, if I have the power, I would like to have more data on the accident data. Because right now the police are busy with confining and locking down people, issuing summons to people who are not abiding to the lockdown rules. But the thing is, when they are taken apart from the system into other enforcement, the road safety itself is jeopardized, you see, in terms of abiding the law, traffic regulations. They are deprived from that. So if I have the power, I would manage the police more carefully, because I think we need them now more than ever, besides looking at COVID and locking down people. Thank you.
Thank you very much, Doc. Dr. Padimang, what would you do now differently?
For my, sorry, Dato. Did you mention my name?
Yes, yes. Yeah. Knowing what you know now, what would you have done differently?
Well, the thing here is it was really a big surprise, the COVID-19 pandemic. But given all the regulations that are in place, it's more of implementing and preparing more on actual cases. But you know, there are procedures on what to do if somebody is contaminated or infected in our workplace. There is a health station. Then before you go to the hospital, and there is a quarantine. There are quarantine places. I think our government did a very, very good job in preventing, controlling, and actually providing businesses to the private sector. Because you know, if you do not do anything about the present situation, the private business will fall. But in the Philippines, construction continued. I think it was only the first 2 months that there was a lockdown in construction, but now it's really very aggressive, in full force. Lucky we are in the construction industry. Because roads, the skyways, the rail system, subway, these are all being implemented simultaneously now in the Philippines. Not to mention the housing. Yeah, thank you.
Miss Wen, you actually managed to control things very well in Taiwan, but do you think you've done everything?
Well, Taiwan until now is very sad. The fatality rate is very low. Otherwise, everyone, road user or people always follow the principle or guideline of the government. We wear mask everywhere. Inside, outside, inside door, outside, we wear mask everywhere at any time. And also we prohibit to drink or eat in high-speed rail, in public transit, no drink, no eat. Also we keep the social distance inside or outside. We also keep the social distance. And so we all the citizens always follow the government guidelines. So until now, the infection is very, very low. That's all.
Yes, Dr. Wen, we're all very, very jealous of you in Taiwan. You've done some magic over there. Dr. Sarawik, I think you're doing very well in Thailand as well. Would you have done anything differently?
I'd like to answer your question. If I could, I think from the lesson learned, we want to think about plan B all the times. COVID is just too fast and unexpected. First, I think we did okay, but we can do better. So the first thing we like to do is to have backup plan in all things that we are doing. And secondly, we like to go faster than this. For example, real-time information. I mentioned in my presentation that we have applications so that maybe people can know in advance of emergency incidents, or even whether they're close to the COVID patient or something like that. So those things, we want to do it, and we want to do it faster. Thank you.
Patrick, would you have done something differently? I can either speak as Pierre or as from France.
You mean the situation in France, Dennis?
Yeah, yes. I mean, knowing what you know now, what would you have done differently? You can respond to that as in two hats, as your general hat as Pierre, and also as your French national hat.
Well, I don't really officially represent France, but I could say as a French citizen that, as a French citizen only, so not an official response, is that the role of roads really needs to be recognized. The role of roads needs to be recognized. In many parts of the world, in some parts of the world, I would say, roads are the bad guys. Like rail is nice. Rail does not emit as much greenhouse gas as roads, okay, and that's correct. But in many cases, if you want to go from A to B, you need roads. Of course, those need to be properly designed, properly operated, and you need to be reasonable and technically savvy in the way you do that. So I think what we've seen here is Richard from Australia showed us empty shelves. I'm sure that they have not remained empty for a very long time. And I'm just guessing that maybe what appeared on shelves was delivered by roads. So I think we have to recognize that roads have a major role to play in transport mix. And just face it, and we've seen that with the COVID crisis, it's a reality. As PR, I don't know, I got rather positive feedback from the webinar series we have organized, or maybe we could have organized even more. And there are some topics that are really very interesting and that we could have addressed maybe a little bit earlier. That's winter service. Winter service will now in January in the Northern Hemisphere. That's great. We organized a great winter service webinar in December. And those REAAA countries that have winter episodes are really welcome to check the recording of that on our website. But it's proved really difficult to, but we are getting there really, to identify the best practice. It's taken us a bit of time. Sharing information freely, we did that really well. Identifying recommendations has taken us a bit of time, but that's normal because we don't want to share and to recommend practice that have not been analyzed further. So basically, we are PIARC, we have been PIARC, and we do what we do best, which is analyze best practice. Thank you, Dennis.
Thank you for that. I must say, I do think PIARC responded very, very well to this whole crisis and very quickly. I think Claude would like to say something. Maybe, Claude, I can invite you to say a few words.
Yes, very short, because the question is very interesting, the last appearing in the question and answers about the vulnerable users, bicycles and people disabled. I think this is a very interesting question. Just to illustrate, because I am, even if you saw a flag from France with my picture, I am a Belgian citizen living in the capital of Europe. And really, there is a complete shift of investments here in Brussels for those vulnerable users, using, sorry for the word, the opportunity of this pandemic to change the way of transport in the town. Not everybody is happy, but that gives me the opportunity to say something else. Patrick has correctly said roads is important. In the word roads are streets included. And that's very important not to forget. A road is a kind of infrastructure, not a rail, but is an infrastructure where you have buses, people walking, and you have sometimes broad streets, but sometimes also very narrow. And the experiences, Patrick had not enough time to illustrate this, but this is of course a capital aspect which has been lived in this last year. I will be short, so I close my words. Thank you very much.
Thank you very much for that, Claude. We'd like to invite the Secretary General of REAAA, Ijazul Akmal, to maybe ask a question or say a few words. Ijazul, do you mind?
Thank you, Doctor. I'm trying to ask this question to Dr. Fadinal with the additional health protocol taken by the conductors in the Philippines. There still construction site clusters, COVID clusters in the construction site. And also, do the government compensate the contractors or consultant for carrying out the additional health protocol at workplace? So I see this in the suggestion by Patrick just now that some kind of recognition by the government should be considered for, to subsidize or to help the contractors in times of this pandemic. Can I forward this question to Dr. Ferdinand from Philippines?
Okay, thank you. Usually, the total construction cost, you have to put it inside the total construction cost already. But what are these? Because the contractor will provide a face mask, a face shield, safety goggles, or other additional PPEs, but plus not to mention the alcohol. The alcohol is being used regularly and consumed much, as well as the vitamins, because although there are some cases, some construction workers, they just drink gin instead of vitamins. A different type of alcohol, but there are very, very few cases in construction site, because these are people who are supposed to be healthy, healthier than most people, because they work hard in the field. So I think these are properly compensated because you can include your costs inside your proposed construction costs. So it should be incorporated.
Thank you, guys. Thank you.
Thank you. I think Claude answered it already, but I don't know whether anyone else would like to add in a response on this mobility for vulnerable road users, women and disabled people. Is there anyone else who would like to add anything to that? If not, then I'd like to take another question, which is come from I.O. Song from Korea, which is, while the government's opposing COVID-19 prevention activities, transportation industry, I would like to know whether there are financial or other forms of support, subsidies, tax benefits by the governments to compensate any disruption to loss of business. And maybe we can just get the various feedbacks from the countries on that. So what subsidies and support for loss of business? Maybe we can again go, Doc, we can start first from Malaysia.
Yes, I think the government have diligently supply a lot of funds and in terms of monetary to the public here in Malaysia in elevating their losses, especially small businesses. Government also been kind enough to open people to move around in terms of they open for businesses, small businesses, tradings, and also other transaction. So I think there are some compensation in Malaysia right now, but that's about it. It's about elevating the economic needs for the people, just to go by and overcome this period of trying times ahead. But in terms of transportation, the government is just basically controlling people movement, and what we are looking at now is just that the governments are allowing certain essential workers to go by in terms of construction and transportation, in terms of trading, and also goods and services, especially health and care. But other than that, in terms of law enforcement, it still goes, but more focusing on locking down and controlling people's movement. That's about it. Thank you.
Patrick, we'd like to come in on the previous response as well now.
In general, actually, no, we haven't really analyzed that. We've seen lots of support, in particular in allowing companies and contractual to delay the payment of their debt, so that they would not be driven to bankruptcy. That would be extreme, of course, but because of the COVID crisis and because of reduced fees and revenues from toll operations. But overall, it seems that in many countries, and I remember, Dennis, your presentation about it, countries have tried to be proactive, not wait for disasters to happen. And that's really testament to, well, in many cases, good cooperations, I would say, between the road sector, the road industries, and governments. If we're talking about making sure that road operations remain open, in a couple of cases, we have seen that it's not financial, it's technical, that material was missing. That it was difficult to access material for roadworks. And that has caused some trouble in some parts. Thank you.
Thank you very much for that, Patrick. I'd like to go back to that question on government subsidies for loss of business, and just wonder whether in Philippines you're doing anything on that?
Yes, actually, the first 4 months during the pandemic was the most difficult because there were total lockdowns, etc. But government was quick enough to provide subsidies, but directly to people, not only for businesses. Businesses came later on. 2020 in the Philippines, it was February. It started February, up to May, those were the most difficult months. However, direct subsidies were given to people. Even our construction workers, they were provided. Subsequently, since you have to balance the challenges of the pandemic and business, it became better up to the present time. But everybody are still very careful in the way of life, the way they handle things, the way we handle our businesses. It's very difficult because even in consulting, you cannot do a lot of field works, which is included in your terms of preference, But good for construction of roads, for example. There's not much problem because you're confined in a specific area. But in consulting work, you have to move from one area to the other to gather data, to validate information and all of those things, to conduct hydrologic studies. So anyway, these are being managed and handled properly by government. Yeah.
Thank you very much, Doc. Ms. Wen, there's an interesting question to you because there's been very little impact to society in Taiwan. Has there been much government support since there's not much impact?
Sure. We have financial support for the public transportation company, like taxi or bus owner. Also, we because to avoid the bankrupt of the travel agency, because we prohibit to foreigner to enter my country, or the travel is prohibited now. So we have subsidy for the travel agency. Also in my bureau, freeway bureau, in service area, because the revenue is decreased very most. So we have the like tax or commission fee reduction. Also the reduce the toll fee in the freeway. That's all.
Thank you very much, Ms. Wen. Interesting, because obviously you would nearly minimize totally the impact of the medical COVID, but the economic impact of COVID is there. And that's why you still had to have these government subsidy programs. Thank you for that. Dr. Surawit, you've also contained COVID very well in Thailand. What is the government subsidies that you have in Thailand?
Well, this is quite sensitive issue though. I talk with a lot of people like the government side and also contractor side, and actually we are negotiating now, and the government, like Philippines, the government subsidize people, not business, but the government looking seriously on how to help business, like for the construction, for example, they try to allow not close down the construction sites, so they can continue working. Well, actually, the government like to see a lot of construction activity during COVID though, and in terms of the direct subsidy, it's not happening yet.
Thank you very much, Doc. Patrick, anything you'd like to say on this issue of government subsidies?
Nothing in particular. I would say direct government subsidies. I'm not sure we've heard a lot of that for subsidies, but we are seeing in some cases government subsidies for road projects in order to restart the economy, because roads can create jobs. That's been the case in several countries in Latin America, for example. Thank you.
Thank you very much. Now, we were meant to stop at 6 o'clock, but I've let us run out because I thought the talk was very interesting. But I have a hard stop at 6:15. But what I'd like to do is to just go around the panelists again and just ask them, what is the one piece of advice you would give to your neighboring countries? So maybe I can go around in the same order. Doc, what would be the one? Dr. Mari's one. There's so many docs here. Dr. Mari's one. What is the word of advice you'd like to give to your colleagues around the region?
It's all about data. Please collect data as as soon as possible, as much as possible, regarding crash data, volume, traffic flow, and also how does the economic impact the fatality. So because we haven't looked at that. So we are looking at, my theory is that the more loss that we are suffering for the country, there should be more loss or maybe there's less life saved or more life saved. We should look at that in the long term run. So it's like basically for my neighboring countries, data. Thank you.
Thank you very much.
Dato', can I slip in one announcement for a while?
Please.
Just want to share this part because I forgot to share this part, and I will be very sad if I don't share this part. It's about, I would like to welcome everybody to join us for our third conference for Asian Road Safety. It's called CARS. Can everybody see this?
Yes, we can.
And then it's going to be held at 6 until June. Will be a hybrid session. So please join us. Submit your abstracts for this conference. We are really welcome pertaining Asian road safety. Thank you very much.
Thank you very much, Doc. Dr. Padamal, some last words of advice, parting words from your side.
Yes, following strictly the government health protocols will save your lives, be it in construction site or in your practical life. You will be saving a lot of lives, not only your life, but the lives of your colleagues and other things. So put on your mask, your face shield, less contact with people, face-to-face contact, and we move on. I am a businessman, so we just move on with business. Deal this COVID-19 pandemic as a challenge in your business. Thank you.
Thank you very much, Doc. Ms. Wen, any good words of advice from you in Taiwan?
COVID-19 has caused a significant impact on our lives. So, and the transportation is an induced demand depending on the economic activities. So, I hope the epidemic is over very soon.
Yes, we hope so too. Thank you very much, Doc. Dr. Surawit, some words of advice from Thailand?
Yeah, well, again, similar to Philippines, people in Thailand, I have to give credit to people in Thailand. They're quite cautious and follow government measures very well. And about the pandemic, I think we have a lot of lessons learned. So why don't we just try to learn from it and do not make any kind of mistake or prepare ourselves in the future.
Thank you, Doc. Patrick, closing words from you. Last words of advice.
Just before Claude, I guess. Yes, word of advice is to look for what transport users' expectations are really becoming. If more of us are going to work from home and to keep working from home, the demand for transportation services is going to be different. This is an opportunity in some cases if you want to do it to drive that change, but it's very important to look into what users really want, really expect. And every country might be different, but that's a good opportunity to really explore that topic and through surveys, for example, and interviews. Thank you.
Thank you very much, Patrick. Yes, Claude, we are very honored to have you join us today for our webinar. Is there any parting words you would like to say?
I promise short, well, exchange knowledge, or motto of PIAC. Exchange, we have learned lessons. We have so many people talking with knowledge. I have no knowledge, but all the people and the experts have knowledge. Let's exchange it. That's really how we are going to tackle with that world problem. Thank you.
Thank you very much, Claude. President Momo, is there anything you'd like to add before I bring this session to the close?
Well, yeah, Dennis, I would like just to extend my thanks and gratitude to all the speakers on behalf of the Road Engineering Association of Asia and Australasia for sharing their knowledge and experiences in their own countries. And I hope that what they have shared with us will be practiced also by other countries. And of course, I would just like to encourage everyone to be more vigilant, to be more careful this time of the pandemic that's still lingering around us. And I hope that everyone will be in good health always. So thank you so much for your attendance. Thank you.
Thank you, ladies and gentlemen. Thank you to the participants. Thank you to the contributors, and thank you to the organizers. As I mentioned earlier, this webinar will be put up on YouTube, and the YouTube link will be made available to you, so you can share that or view this later on. There will be another REAAA webinar, the third in our series, that will be planned in Q2 of this year, and the theme will be technology and smart construction. If you would like to present something there, please do write in to the Secretariat. REAAA is a non-profit organization, really here to share knowledge amongst everyone. And if you like what you happened today, and you're not a member of REAAA yet, I recommend, strongly recommend, that you become a member of REAAA. What we've posted up here is the details of how to become a member, and the website, and of course the email address of the Secretariat, which you can write to. And with that, I would like to bring our webinar to a close. Stay safe and be healthy, everyone. Thank you.
Thank you.
Thank you, everybody. See you. Stay safe.
Thank you.
Thank you. Best wishes to everybody.
Thank you. Stay safe. Bye-bye.
Bonsoir.
Have a good evening.
Bonsoir, Patrick. Talk soon.
Bonsoir. Bonsoir, Ken.